Now, age-related changes in an Asian eyelid can mean just about anything. It can mean that the crease that you once had has lost definition, or the person has some ptosis that's developed, or they've started to lose fat volume in the upper or lower eyelid area or the areas around the eyes. It can really be a lot of different things, and it can be on someone who's 32 years old, 35 years old, or they can be 45 or 55 or 65 or older. The requirements for an age-related Asian eyelid surgery case, the amount of work that you have to do starts to go up. You start increasing the operating room time, there's more skin that's being removed, sometimes more fat needs to be manipulated. Notice that I didn't say removed, I said manipulated. Sometimes the lacrimal gland and the lateral aspect of the lid is sort of bulging out or herniating out. You have to push that back into the eye socket or into the orbit underneath the orbital rim. Sometimes some of the fat of the orbital area that is usually posterior to your septum has started to move forward. And hopefully your surgeon, if they're experienced in age-related Asian eyelid surgery cases, can take care of those issues at the same time. But for age-related cases, you almost never want to take fat out. Oftentimes you're taking skin out. You're not always taking skin out right by the crease or near the lash line. Occasionally you're performing an infrabrow incision underneath the brow. And why would you do that? Well, as patients age, if they have thicker skin and a heavier brow already to begin with, if you only perform an Asian blepharoplasty on the eyelid near the lash line where the crease is, the skin that remains above that area can be a bit thick and puffy. So sometimes you actually need to do both. And so what that means is you have an incision underneath the brow or above the brow, and that leaves behind the thinner skin towards the lash line. And sometimes you still have to perform anchoring technique in order to ensure the crease has good definition, even though you've already taken thicker skin from around the hair-bearing brow area. Now, in addition to all that, for age-related changes, occasionally patients need fat grafting. That means suctioning out very carefully fat from around the abdomen, the waist, the thighs, and injecting it into very small deposits in the upper eyelid space, the lower eyelid space, or the area around the eyes. And age-related cases usually take more time, sometimes twice the amount of time as these other topics that I mentioned before. And that means that they're oftentimes more expensive, more time-consuming. There's more healing time for the patients. And if you're a patient who is well into their career and you're a bit private about what you do, but you're still trying to rejuvenate the eyes and the area around the eyes, you need to take into consideration the possibility or the probability, the likelihood that your healing time in a social and professional sense is going to be longer. If you don't want anyone to know what you're doing, you don't want your colleagues at work to ask you about any surgery that you've had, then your healing time may not be 1 or 2 weeks. It may not even be 3 or 4 weeks. It might be more than that. And that doesn't mean physically you're not healing well. It just means that socially and professionally you have anxiety about what you just did and you don't want anybody to know. And your surgeon can't control how you feel about that. So you need to plan accordingly if you're a private person and you're well into your 30s or 40s before you go out and have Asian eyelid surgery or any kind of surgery of the face for that matter.